As women age, especially after menopause, their risk for cardiovascular disease increases significantly. This is largely due to the decline in estrogen, a hormone that helps protect blood vessels. But what if there was a way to counteract this risk through lifestyle changes? In this video, we'll explore a recent study that investigates how aerobic high-intensity exercise can improve cardiovascular health in older postmenopausal women. We'll break down the research, the methods, and the key findings, and discuss what it means for women looking to stay healthy as they age. Women are generally protected from vascular diseases during their reproductive years, thanks to estrogen. However, after menopause, estrogen levels drop and the risk of heart disease rises quickly. In fact, older women can have a similar or even higher risk of cardiovascular events compared to men. This makes it crucial to find effective strategies to support heart health in postmenopausal women. The study we're discussing today specifically targets women more than 10 years past menopause, a group often overlooked in exercise research. Main goal of the study was to determine whether a period of aerobic high-intensity training could improve central and peripheral cardiovascular parameters in older postmenopausal women. Researchers hypothesized that such training would increase maximal oxygen uptake, but might only lead to limited improvements in artery function and certain muscle proteins. To test this, they designed a rigorous 8-week exercise program and measured a range of health markers before and after the intervention. The study recruited 11 healthy postmenopausal women, with an average age of 64 years and an average of 14 years since menopause. All participants led sedentary lifestyles, meaning they were physically active less than 2 hours per week for the past 2 years. Strict inclusion and exclusion criteria ensured that participants did not have chronic diseases, metabolic syndrome, or recent hormone therapy, making the results more reliable for this specific population. Before starting, the study received approval from the Ethics Committee of the Capital Region of Copenhagen. All participants underwent a thorough health screening, including interviews, blood tests, and ECGs. They signed informed consent forms and were cleared by a medical doctor. This careful process ensured the safety and ethical treatment of everyone involved, which is especially important when working with older adults. The research followed a pre-post design. Each participant completed one experimental day before and after the 8-week training period. On these days, researchers measured body composition, blood pressure, blood lipids, and maximal oxygen uptake. They also took muscle biopsies and assessed artery function using advanced imaging techniques. This comprehensive approach allowed for a detailed analysis of how high-intensity exercise affects the body. Before the intervention, participants underwent a series of baseline tests. These included body composition analysis using DXA scans, maximal oxygen uptake tests on a cycle ergometer, and a graded knee extensor test. These tests established each woman's starting point, ensuring that any changes observed after the training could be accurately attributed to the exercise program. The core of the study was an 8-week supervised aerobic high-intensity interval cycling program. Each participant attended 3 sessions per week, each lasting about 60 minutes. The sessions were carefully monitored to ensure that heart rates exceeded 80% of maximum for most of the workout, with short bursts above 90%. This demanding regimen was designed to push cardiovascular limits while remaining safe and manageable for older women. During each training session, participants wore heart rate monitors to track their intensity. The goal was to spend about 70% of the time above 80% of their maximum heart rate and 10% above 90%. This ensured the exercise was truly high intensity, which is believed to be key for driving cardiovascular improvements. The sessions were supervised by research staff to maintain safety and adherence. After 8 weeks of training, participants saw notable changes in body composition. Body mass and fat mass both decreased, with fat percentage dropping from about 39% to 37.5%. Importantly, lean body mass and muscle mass remained stable, indicating that the weight loss was primarily due to fat reduction. These changes are significant, as lower fat mass is linked to better heart health. The training intervention led to a small, though not statistically significant, reduction in systolic and diastolic blood pressure. More notably, plasma HDL, the good cholesterol, increased significantly while total cholesterol also rose slightly. These changes contribute to a healthier cardiovascular profile, as higher HDL is associated with lower heart disease risk. One of the most impressive results was an 18% increase in maximal oxygen uptake, or VO2max, after the training period. This measure reflects the body's ability to deliver and use oxygen during intense exercise, a key indicator of cardiovascular fitness. Such a large improvement in just 8 weeks highlights the power of high-intensity aerobic training, even in older adults. Researchers measured blood flow in the femoral artery during knee extensor exercise, both before and after the training. Interestingly, after the 8-week program, blood flow during submaximal exercise was actually lower. This might seem counterintuitive, but it suggests that the muscles became more efficient at extracting oxygen, requiring less blood flow to achieve the same work. Flow-mediated dilation, FMD, is a measure of how well arteries can expand in response to increased blood flow, a marker of vascular health. In this study, FMD in the popliteal artery did not change significantly after training. This suggests that while high-intensity exercise improves many aspects of cardiovascular health, it may not directly enhance large artery function in older post-menopausal women. Although FMD did not improve, the baseline diameter of the popliteal artery increased slightly after training. This indicates some degree of vascular remodeling, meaning the arteries may have adapted structurally to the increased demands of exercise, even if their functional response to blood flow did not change. A key part of the study was analyzing muscle biopsies for specific proteins. After training, levels of estrogen-related receptor alpha ERR-alpha and endothelial nitric oxide synthase (eNOS) were both significantly higher. These proteins are involved in muscle adaptation and vascular health, suggesting that high-intensity exercise can activate important molecular pathways even in late postmenopausal women. Using the American Heart Association's risk calculator, researchers found that the 10-year risk of heart disease or stroke dropped by 8% after the training program. This is a meaningful reduction, showing that even a short period of high-intensity exercise can have a real impact on long-term health prospects for older women. Like all research, this study had limitations. The sample size was small, especially for some measurements like FMD. Some data points were missing due to technical issues or insufficient biopsy material. However, the consistency of the main findings and the rigorous design lend confidence to the results, even if larger studies are needed to confirm them. The results strongly suggest that high-intensity aerobic exercise is both safe and effective for improving cardiovascular health in older postmenopausal women. The training was well tolerated, and participants saw improvements in fitness, body composition, and risk factors. This type of exercise could be a valuable recommendation for women looking to maintain heart health as they age. To sum up, just 8 weeks of supervised high-intensity aerobic cycling can lead to significant improvements in cardiovascular fitness, body composition, and molecular markers of muscle health in older postmenopausal women. While large artery function may not change, the overall cardiovascular risk profile improves, making this a promising strategy for healthy aging. This study adds to the growing evidence that exercise is a powerful tool for promoting heart health, even later in life. Future research with larger groups and longer interventions could further clarify the best exercise strategies for postmenopausal women. For now, the message is clear. It's never too late to start moving and improve your cardiovascular health.